Good morning. We're going to be doing silhouette threads today, and I have a patient who's kindly volunteered to let me film it. She's had them before and really liked them, so we're going to do them again because she's going on vacation. She wants to look. So the silhouette threads are made of the same material as absorbable stitches, but they're a little thicker and they have little cones on them. And what that allows us to do is insert them, and then using those cones, I can pull the thread tight and the cone locks it in place. So we'll go through the procedure and do that. It's a pretty easy procedure, it's pretty quick and has some nice results. So the first thing we do is we make a little insertion, and that's where the thread is going to go. Now I've already numbed her up here, so it hurts a little bit, but not too much. So this is the thread, and I think you can probably see the cones there, right? So we insert, we go to the dermis, and that's an area of the skin that doesn't have so many pain fibers. So the thread goes pretty easily in that area with a little discomfort, right?
It's horrible. It's horrible.
And then we do the same thing in the other direction. The upper thread, I'm going to lock the cones in place. And once those upper threads are locked, then we go down and we lock the lower threads. You can see how this has really come up compared to this side with the threads. There's a little dimpling that does occur in the first few days, but that goes down. That's just where the threads go in, but that will disappear. And I think you can see how much lifted this is compared to this side. We're going to be putting a silhouette thread on the left side of the face. You can see the cones here. These are what allow us to anchor the thread in place. And what happens is I go through a small insertion I've already made. And then once we're in the dermis, we just thread it down to the location we've already determined. And then we're going to do the same thing on the lower face. Again, you can see the anchors. And then we just go in the other direction. And what we do is once we have the threads in, we're going to lock the upper threads. And what I'm doing is as I apply gentle pressure, is I'm pressing down on those cones that I showed you earlier. And those cones will lock into the tissue, and that's what kind of allows us to do the pulling or the tugging. And once we do that, remove the excess thread, and then with a little gentle pressure here, we do the same thing. We lock these threads into place. Now, what happens is these threads get locked into place, and then as time goes on, your body replaces the threads and the anchors with collagen. So the thread lasts about maybe 9 months, depends from person to person. But as the thread is absorbed, it's replaced by collagen. So we usually tell patients the results are about a year, but sometimes you may get a little more because of that replacement with collagen. I think she has a little more laxity here, so we're gonna put one additional thread over on this side. Here, where she had a little bit of the dimpling, you can see that even just in the few minutes that we've been doing the other side of the face, that dimpling starts to go down a little bit. Hopefully you can appreciate just with that one thread how the corner of her mouth came up a little bit. And then the other thing is that you see some immediate results, but once the swelling goes down and the threads start to kind of lock in place, it causes a little additional tightening that you see over the next week after the procedure. So you leave here looking good, but really about a week later, you're gonna see maximum results. And I think you can see how she's nicely lifted on both sides. There's a little dimpling, but that will go away. And then what we'll do is we'll ask her not to make any big movements with her mouth. So no eating apples, anything like that. And then we want you to sleep flat on your back. We don't want you to sleep on your sides. That's just for a few days until the thread's completely locked in place. Did you survive?
Mm-hmm.
Okay, all right, thank you.